And I would like to welcome everyone to this afternoon and the workshop on how healthcare can be a leverage for implementing sustainable infrastructure in developing countries. My name is Johannes Brundin, and I'm a project manager at Nordic Center for Sustainable Healthcare and at TEM Foundation. And I will be the moderator today and introduce you to this topic and all the speakers we have today. The background and the purpose of this workshop is that we at TEM made an innovation agenda, a national innovation agenda on sustainable healthcare a number of years ago for Vinnova and the Swedish Energy Agency. And we have been working with, we established what kind of stakeholders that are involved in this area and need to be on board to develop sustainable healthcare as a concept. So we have been working a lot with private healthcare, public healthcare, universities, entrepreneurs, state, but not so much with NGOs and the development part. So that's why we joined the Swash and Grow project, which is managed by RISE and financed by Vinnova. And you will hear more about that in a minute. But there are 27 other members in this project, and we joined forces to them to look into how we can develop sustainable healthcare as a leverage for implementing infrastructure in developing countries. And for that, setting up a platform for to promote innovation, export, financing, knowledge. And in this workshop, we have invited all of you to take part and look into what the next steps may be for developing it further. Some practical information for this workshop. We have a lot of presentations today, so you'll get inputs from different angles, and this will be followed up by a panel discussion where you will be able to ask questions, and we will have a discussion. Questions to the speakers, you can ask them after each presentation if there is time for that, and you can also ask questions in the panel discussion as well. You can write the questions in the chat or raise the hand. It's good to have the questions prepared in the chat if that's possible. The event is recorded and the presentations will be available on the Nordic Center for Sustainable Healthcare's YouTube channel and probably on Swash and Grow. We can reach them from the Swash and Grow webpage as well. If you want the PowerPoints, you should contact the speaker. And please be muted if you're not speaking. And it's always good if you have the camera on from time to time, so we'll get some interaction between the speakers and the audience. Without further ado, I would like to get on to the program for today. As you see, we have many speakers. And the idea as the first workshop in addressing sustainable healthcare in developing countries, we want to have different views from different angles. So we have invited organizations that are working on the field, as well as organizations representing the funding or financing, and also companies that are representing the technology, as a technology providers. So with this constellation, I think we'll get a good discussion to move this topic forward. The first speaker of today is Stenbeck. He's Senior Project Manager at RISE, the Research Institute of Sweden, working with urban water management. And he will give you an introduction to Swash and Grow and the scaling of off-grid wash innovations. The screen is yours, Sten.
Thank you. I'll try to share my screen here. Okay, so my name is Stenbeck. So I'm have been working in Southern Africa for quite some time, 6 years, looking into off-grid wash solutions and water and sanitation and health solutions for Southern Africa, but also in India and a little bit in China as well. So this project is a project that is funded by the Swedish Vinnova program, a UDI program. It's a step 3 project, and it's RISE and Stockholm Environmental Institute who is running the program and the project. And the whole objective of this project is to develop tools that improve the opportunities for innovators and aid organizations to bring more circular, inclusive, and sustainable innovation to those in need. So this is really the main objective of the whole thing. And then you could, of course, think, what are the problems we try to solve? And the thing here is that we see that the best solution don't reach out, which means that the most sustainable and circular solutions, and what we mean then is the best value for money in the long run, has difficulties to get out and to reach out. And that is very much due to problems in the market. Of course, there is the big problem is that the people suffer due to badly designed sanitation, which then can get social instability and risk for war and conflict, but it's a sub-optimized market behind that. There are complex problems, no decision support, expensive market introduction for those that are very innovative. And that means also a sub-optimized innovation system, which means the lack of sufficient incentives, tools, and decision support systems. So the project is very much about trying to overcome this, try to find out how we could make the innovation system more effective, and then get a better market for new innovations. So what we do in the project is that we work with the buyers. We have a representative from the buyer side. We also have a representative from end users, where we do assessments on and understanding better the end users. We also work with local agencies, and we also work very much with innovators, but also, of course, accelerators and those of like us, the Research Institute of Sweden, that is supporting the whole market in getting more sustainable innovations in place. So the whole idea is to develop tools that can then make the market a little bit more effective and get more innovative solutions to the market. So the whole idea here is these are the products, the results that we expect from the project. We want to have a report understanding better on the success factors of off-grid and in humanitarian development settings, cross-cutting, to give guidance to innovators on what can work and may make a difference. We want to develop a tool for validation and evaluation of clients' requirements, because we want to understand better how we can get out the innovations. And then, of course, those tools also for scaling up and export, how can we lower the barriers to know which procurement processes are relevant for product market fit, and what kind of business models and strategies do we need for the scale up. We're also developing an Internet of Things tool for operations and monitoring of decentralized sanitation systems, which is tried out and developed in Lebanon in some informal settlements there with a Swedish innovation on wastewater. So it's decentralized systems. And we're also developing a university course module, which Malmö University is developing. That is for long-term capacity development for innovators, which means basically that the engineers better should understand what are the context, what are the circumstances to develop innovative circular solutions for those kind of settings that you can find in humanitarian and development settings. So the whole idea is here to try to overcome those barriers that we have in the market today, to get better innovations out there, but also to get better delivery out in the market. So of course, we expect to have an impact on the Sustainable Development Goals, to improve several of them. So these are the ones that we could identify as those that we thought was mostly relevant for this project. So it's really to create the means to empower vulnerable populations, because we look into the inclusiveness of innovations, but we also want to increase success of procured, delivered sustainable circular solutions. So this is a little bit of a top of the mind, a very nutshell on what this project is about. And this workshop today is really much about trying to understand how we could scale up and export, or deliver, I would say. I mean, export is a Swedish perspective then, but scale up and deliver more sustainable circular solutions. So I think I'll stop there for my introduction.
Yeah, thank you, Sten. This is a very interesting project, and it has a very broad perspective on connecting all the different stakeholders in this area. And that's why we, from the sustainable healthcare perspective, see this as a very interesting project. It do also have this business-oriented perspective. We will also look into that a little bit more in a minute. Thank you very much, Sten. So now we'll go to the next speaker. It's my colleague, Daniel Eriksson. He's director for TEM and founder of Nordic Center for Sustainable Healthcare. And he will talk a little bit more on what is sustainable healthcare and how it can drive sustainable infrastructure and implementation in developing countries. The screen is yours, Daniel. You have already shared your screen.
Thank you very much, Johannes, and I'm glad to be here today. As Johannes said, we are working with TEM. TEM is a self-funded foundation founded in 1984. So we're this independent NGO, etc., and very unique in this field. We are self-funded. We don't have any, annual grants from any local authority and so on. We run two different networks. One is more regional regarding CSR, but then we also have the Nordic Center for Sustainable Healthcare that we founded a little bit more than 5 years ago. And me, myself, I've been working for, 15 years with sustainability in healthcare. Started out as an environmental coordinator for a university hospital, and then joined up with Johannes and been working all over the world with these matters, from clean tech to healthcare to life science to hospitals, regions, etc. But here today are we to discuss Nordic Center for Sustainable Healthcare, around 120 members. We have members from universities, we have members from companies, from regions, a lot of clusters and network, etc. from all over the world. I think we have members now from 4 different continents. So our ambition to begin with was to have members from all the Nordic countries, but we have succeeded that and more. And this is growing, and this is an area that is growing by itself, so to say. We're a small organization up in the north, but the interest for sustainable healthcare is like booming everywhere in the world. So even if we're a small organization, we get pretty high impact in many places. You can call us more or less like an umbrella organization. Together with members, we join up to perform different projects. Could be members, different partners with different funders. And this is some of the funders we have for the past 5 years, creating different things. So what do we mean by sustainable healthcare? And I can advise you to attend our introduction training for 4 hours, and then I will explain what sustainable healthcare. But in short, the healthcare industry is a massive industry in the world. This is a WHO mapping. It's a few years old, and they don't have any newer one. But just so we get the numbers and get the perspective on this. If we're looking at the Nordic countries, those who are green here, then we're talking about roughly 10% of the GDP is healthcare. That means 1 out of 10 krona or euro or dollar that is spent within healthcare. Looking at US, for example, there are 16-17% of GDP. That means that just by its size, the healthcare industry is huge compared to almost anything. If you look at more mid and low income countries, of course, there's a difference there on the amount you spend on healthcare. It could go as low as less than 3% or 3 to 5%. But that also means that those countries, when they are also striving to get around, let's say, 10% of GDP. At the same time, you have a population growth. That means that in many of these low and middle income countries, the interest in healthcare is exponential from our point of view. There's a huge need of investments in hospitals and primary care and different ways. That also means that they can, in some cases, skip some of the mistakes we have done and go directly to those things that work. So the huge development in healthcare today will happen in those low and middle income countries, I would say. And all of this is supposed to go green. Everyone here is supposed to work with the global sustainable development goals, etc., etc. So the greening of the global healthcare industry is huge and ongoing, and in some cases exponential. We're looking at the impact from healthcare just to get a view. There's one report that came from Healthcare Department Europe for 1.5 years ago, roughly. I think it was 4.8% was CO2 emissions for healthcare. As another report from Europe saying 4.4. Another older study said around 5% of the CO2 emissions in Europe come from healthcare. In comparison, if you compare Europe, we can say roughly 5% of the CO2 emissions from healthcare, around 3% post-corona, I'm going to say. Pre-corona, it was 3% from aviation. So 5% roughly, depending how you count, from healthcare, 3% roughly from aviation. If we're looking at direct industries, as we do here on the staples to the right, just a comparison on the carbon footprint of the pharmaceutical industry compared to the car industry, the automotive industry. And here we also see the huge impact that we have from this. And this is, for many people, a bit of a surprise. You don't think of healthcare as this huge global emitter. But it's mainly due to its size, but also because you have specific elements in healthcare that has quite high impact on the environment globally. And if you look at around here in the Nordics, we're quite much lower than many countries. And that also means that the Nordic countries can actually contribute to lower CO2 emissions globally, but just doing as we do it in the Nordics. Even if we're looking at Europe as a whole, if the whole Europe were supposed to do the same things as Swedish or Norwegian or Finnish healthcare, then we could lower the CO2 emissions in Europe by percentage, the total amount, if we go from 4.8 to 3.8, let's say. So it's huge numbers, and there's a lot to be done, and there's a lot of lessons to be learned here. So the main problem also with healthcare is that the healthcare services stress the environment. Environment may cause illness, and ill people need health services. So just by contributing to this negative environmental impact globally, the healthcare actually creates more patients to itself, which means it needs to expand, and then it will create more patients due to the environmental impact. And this is something that needs to be changed, of course. And there we're not talking only about, we can talk about sanitation or pharmaceuticals or many things. So we need to make healthcare more sustainable in many ways. And these are just one or two and a couple of topics that we need to address, from logistics to single-use items, climate, pharmaceuticals, buildings, chemicals, supply chain, etc., etc., etc. So this is many topics that need to be covered in the future. If you're looking at sustainable healthcare from a business point of view or from an industry point of view, we made this model a few years back, and sustainable healthcare, we see this as a new industry that is horizontal over these old industries, so to say. So sustainable healthcare is not medtech or life science. It's medtech and life science and clean tech, but only when you have the application for healthcare. So medtech and life science companies with good environmental performance, that is sustainable healthcare. Clean tech, but only clean tech that has applications for healthcare are sustainable healthcare. Architecture and construction, when you're building green hospitals, etc. This is a problem that we're stepping over these old silos because many clusters and networks, even funding goes directed to these different silos while we try to move on the horizontal level. But if you're looking at each of these silos, sustainable healthcare is a small part, but combined it's a pretty huge industry actually, and we would like to figure out how big that industry is if you take the numbers from each silo. You can also use this to put on a university and see this as different faculties. There's no one faculty at the university that is sustainable healthcare. It's many. So it's a very multidisciplinary subject. Johannes showed this also. We did this when we started Nordic Center 5.5 years ago. We did this, what are stakeholders we need? And now we have learned that this is called a multi-helix model. We didn't know that when we created it, but now we know it's a multi-helix. But this is true that you can sit in your own little bubble and just discuss development, or sit in your bubble and discuss legislation between authorities and state. You can't just have companies sitting and preaching for other companies. You need to mix all this together to get something to happen, to get this wheel moving. And there's many projects and clusters and network, etc., where you sit in one of those pieces of pie and everyone agrees on everything, but nothing is moving forward. So we would strongly believe to get all these stakeholders into one arena to work in the same direction. As I told you, we saw this as a new industry. We also see this as a new sustainable healthcare, as a new research field, a new innovation field that doesn't fit into all the old startup communities and so on. And we're looking at the new industry. There's of course a need for a home market, no matter where you are from, and test beds and those kinds of things. But to get the truly impact, you need the internationalization. And especially if you're looking for the Nordics, we're very small countries, not that many people. So if we do something at all the hospital in the Nordics, it doesn't have that much impact globally. When we do the same thing in India or in South America, or wherever in the world, times 1,000, then of course it's there we're going to get a big impact. Here are some examples on what we do, different delegations and webinars and so on, to show the interest is from everyone from Canada and US and from Israel and so on. And that's just to show that this is a really huge interest globally. And even if you're a small organization, we're getting now contacts and that we couldn't dream of a few years back, because not everyone is looking into sustainability in healthcare due to COVID and Corona. So something has drastically changed the last year, and we have been pretty well positioned for that. We didn't know that, but apparently we was. And this is a few examples on publications we have done in the last year. Mostly are not peer-reviewed, and some are from elsewhere here. But this is a lot of documentation, and unfortunately, a lot of this is in Swedish, except the Nordic white paper and so on. And this is a problem that we're trying to solve now, that there is a lot of good things that have happened in the Nordics and different countries, but the information is not accessible in English. So if you Google sustainability in healthcare, you came to the same old organization, hospital in UK, and you get to US and so on due to language advantage. So what you're trying to do now is create a series, or we had created a series called Nordic Know-how on sustainable healthcare, when we penetrate each topic, putting out good Nordic examples and showing actually what has happened in these different fields and actually installments. We get this information out in English. I think the number 5 Nordic Now will be published now in a week or so. This is also to show that this is a work we did together with the Business Region Gothenburg, just showcasing how the life science segments and the care management and global challenges within the healthcare really interline with the different goals in SDGs. And we have been very conservative, so to say, when we're matching this. So if you look at a specific company, you can get, more, cross relations between different goals in the companies. And this you can also find on the web page. It's also good to know that we were in the Nordic Ministry or Nordic Innovations group on sustainable healthcare, where they try to on healthcare, trying to pinpoint the Nordic strongholds within healthcare. And the number one after that study between the Nordic country was sustainable, innovative hospitals. So there is an interest and a need for doing this in the future. If we're looking into creating a business opportunities and using healthcare as a leverage, as a topic is today, we had this discussion with actually, the idea came from, we had a discussion with a hospital being built in mid-Europe, and they were very interested in getting this district heating and district cooling, but in the city they were building this new big hospital, it didn't exist. So we were thinking about, we're talking to the hospital and said, why don't you go to your local authorities and say, we can sign up for district heating and district cooling. We can sign up for 40% for 30 years. We can make a long-term commitment with the local energy company and the local municipalities. And all of a sudden, we have created a business opportunity. But this is a very good business opportunity for a publicly owned or a private company, that you get one big client that can sign up for a long-term commitment. And all of a sudden, the hospital could be the leverage for implementing these things in a larger community, even a city. And as far as I know, this is happening actually now in that city in mid-Europe, where the local municipality can create an energy company that can supply these things to the hospital. And all they needed in this case is the long-term commitment. Or if you're just using this to expand the supplier, it can be green electricity, clean water, biogas digestion, public transportation, where the hospital and primary care center can, it's the first, node in the community. And you, with a slightly higher investment or smarter investment, you can in many cases expand this to a larger portion of the community. It could be water, wastewater, energy, etc., to a larger surrounding area. So the hospital is the node, the first node, and then you have a larger expanding area. This is not, of course, very simplified, and it's much more complicated than this. And I'm sure our speakers today can get into a little bit more depth in this one. Or you can do it much more advanced, of course, where you have local energy grids and energy storage, and you have the community and the hospital leveling each other. It could be demands and loads can be different, where the hospital need higher loads on weekdays and the community on weekends and evenings, etc. And there can also be quite effective pricing incentives here between the local community and the hospital, where they actually get smarter grids doing this, leveling the hospital and surrounding communities. And there's obviously thousands of different solutions providing these kinds of things. But the idea is to have the hospital as a node, or a hospital as a leverage for getting these installments in a larger scale. And this is something that is perfect for even if you're here in mid-Europe, but also for the low and middle income countries, where the investments in healthcare will be massive the coming years. And the healthcare then can be this leverage, is our hope and idea. Because we see this is, as I told you, this is something that's happened. There is a new trend fueled by COVID-19. There is some kind of paradigm shift towards a more circular, resilient, and sustainable healthcare, and this leads to a lot of new opportunities. Everyone is talking sustainability, everyone's eyes are turned to healthcare due to COVID. So now is the time where we have these opportunities that we have never had before, so to say. And this is just something that we're producing right now, because there are so many good solutions out there that never anyone know about. So we are creating now the world's greenest hospital.org. Will be launched now before the summer, where we will actually put in around 100 of the best solutions that exist today and already are installed in hospitals. So you can easily find this to this virtual hospital that we're creating. It's undergoing programming as we speak. And May 12th, we have a report and webinar on Nordic Know-how 5, renewable energy in healthcare. We have a training in sustainable healthcare. In June 10, we have a joint webinar with Yale, Lancet, Northwestern, NHS, University College London, and a few more. It's a seminar series on Nordic sustainable healthcare and how do they do it. Mostly aimed from US market, but it could be interesting here as well. And September 28th, we are doing our first delegation since COVID started. So we have decided that September 28th will be free to travel. So we hope that we can go to Warsaw then. Thank you very much.
Yeah, thank you, Daniel. Do we have any questions? I think we have time for a question if you have anything. Otherwise, if you would elaborate a little bit more on an example of how this model could be used in developing countries.
I think in many cases it's, and I think maybe Johan from the Capital Guide can elaborate on this a bit later on. But I think this you will get a bigger impact if you use funding wisely, funding aimed for different things. So you have funding that are made for healthcare. It's their own pot of money, you know. From there, it could be the World Bank, it could be anyone else, and you have funding for clean energy, clean water in surrounding neighborhoods. I think it's in some cases it's a bit sub-optimized, where you can get a lot higher value if you combine these different funding, where you're using actually a hospital as its leverage. Because in many cases, if we're looking at big cities, even in low and middle income companies, the countries, the hospitals are very advanced. There's a lot of technology, and this creates an opportunity to make just a little higher investment, or in some cases, I could guess without knowing that you didn't even need to have that much higher investment. You have the capacity to serve a larger portion of the community just by the surplus you might have on evenings or on weekends, or when the loads at the hospital are lower. So I think there is a lot of smart things to be done within this area.
Yes, we had a question here. How do you get to the sustainable solution catalog database?
You can't at the moment, but you will be able in a month, 2 or 3, go to worldsgreenesthospital.org, and then we'll have all the solutions there. So we are building it right now.
Yes.
So this will be very good actually. There's a lack of this. The only thing we have, we call it the Nordic view. So everything there must be installed at a Nordic hospital. So you actually can go and see it live and ask those who are working with it if it works or not. So no future and no future innovations not here. Actual solutions that exist today that are installed.
Thank you, Daniel. Daniel, you have another question in the chat. You can maybe answer it in the chat, but we need to go to the next or proceed with the program. And I would like to introduce the next speaker. It's Ian Milimo, a project manager at UNDP in Istanbul. And he will talk more about creating sustainable healthcare infrastructure in developing countries. The screen is yours.
Thank you so much. And yeah, let me begin my presentation this afternoon by thanking Johannes and the team for giving us a slot as UNDP. We thank you sincerely for that. Let me also briefly acknowledge and thank SIDA, who have been providing financial support to us to enable us reach the 10 countries and beyond where the project is being implemented by both UNDP and Healthcare Without Harm. Let me go straight into the presentation, and just to highlight that my presentation this afternoon will focus on 3 main areas, and this is on energy infrastructure. We'll also discuss briefly on water and waste management, and then we go to look at case studies that we have in the countries. But just to mention that our work goes beyond these 3 areas that I've mentioned. We do quite a little bit more than this. So as a way of introducing the project, this is a project that is implemented in 10 countries and beyond. We are working with Healthcare Without Harm to implement the objectives of this project, which are 4. The main goal of the project is to reduce harm to people and the environment caused by manufacturer, supplying, implementation, and disposal of health medical products. We have 4 main objectives that we are pursuing in this project. The first one is we are working with partners to develop the Sustainable Procurement Index for the health sector. Very pleased to mention that we are almost near the completion, and we hope to make this tool globally available to manufacturers, suppliers, and procurers of health commodities. The second objective is building the capacity for sustainable procurement. This is an area where we are trying to strengthen the demand side of the curve to ensure that the countries that are procuring these commodities are ensuring that they are procuring those things that can be used and also are sustainable. Thirdly, we are strengthening the capacity of manufacturers, and this is the platform where we interact with producers of health commodities to ensure that they are also in tune with the game, to ensure that they are producing commodities that are not going to cause harm to the people and the planet. And finally, the project is also working on results for measurements. So let me straight away go into my first part, which is on our work in terms of renewable energy. We are working on this project in many countries where we are present, the 10 countries that I mentioned and beyond. And essentially, we are driven by a number of benefits that we are already seeing in terms of being able to contribute to clean and stable, reliable supply of energies. Most of these countries where we are implementing the project are in the developing South, which means most of them are in remote areas where availability to power grid electricity is almost non-existent. And therefore, we are seeing this as an avenue for us to provide stable and clean energy for the health sector. In terms of also climate resilient, I think in many parts where we're operating, it's either you see a drought or floods. All these create a challenge for the health sector. As a result of converting our energy sources to renewable energy supplies, we are promoting and increasing the resilience of the health sector to ensure that there's a continuum provision of services to the people that we are serving. Additionally, by also focusing on renewable energy, the additional benefit that we are seeing is, of course, reduced carbon emissions. I think we are coming from a situation where many of the health sector centers that are located in remote areas were using diesel to power their operations. By introducing solar panels, by introducing any of these products, this is our contribution to the reduction of carbon emissions. And finally, I think additional benefits for employing renewable energy is the cost-saving measures that those hospitals that we are struggling to meet electricity bills, we are already seeing by converting into using renewable energy like solar. So of course, these benefits directly accrue to the health facilities where we work in. In terms of what we've done on the ground, essentially is to support the evidence generation to ensure that there's increased demand and uptake of renewable energy. I think we are coming from a background where majority of the countries were dependent on the traditional source of energy, which is mainly hydro. So how do we ensure that we support the value for money proposition? It's basically by ensuring that we are generating evidence that we can avail to policymakers. We are also creating partnerships with the private sector at all levels. I do remember and know too well that in Zambia, for example, we have quite a number of Nordic private sector companies that have participated in the deployment of solar through a program that UNDP has called Solar for Health. We are also working with local private sector to ensure that the maintenance of these products that we are procuring is ongoing. We do realize that this is a new technology and therefore we need to be building the capacity of local private sector to ensure that they maintain the products. We are also developing policies at different levels, at national and subnational, to ensure that there is wider acceptance of the practices that we are preaching. We've also worked with University of Dar es Salaam in Tanzania, and I'll be presenting a few slides, a few results that are coming from there. But also UNDP has supported in a number of countries the introduction of renewable energy for the healthcare supply chain. For example, in Zambia, the Medical Stores Limited now has adequate supply of energy through the solar installations that was done through a UNDP project. I did mention that we did a case study in Tanzania, and essentially the aim was to assess the energy efficiencies that were being upheld in hospitals. We wanted to determine also the energy consumptions in terms of the appliances that were installed in hospitals. We also wanted to establish and measure energy efficiencies parameters that could easily be scaled up. We also wanted to identify energy saving possibilities for the health facilities, especially those that we might term as long hanging fruits. You will see from the pie chart that I have here that there are quite a number of opportunities that are already showing. So you could already see that the consumption of electricity and energy differs from each section of the hospital. For example, you can look at the laundry services at Muhimbili National Hospital, where the laboratory services is consuming 25% of the energy sector. And when we look at the Morogoro Regional Referral Hospital, you are seeing radiography consuming about 16.37%. So this study was able to show us how the different departments of the hospitals are consuming the energy that was available to the institution. Additional finding in terms of room type, again, this is where it gets very interesting. You will see from the pie charts here that offices at both facilities were consuming a large chunk of available energy. Yet key infrastructure, key sections, key departments like ICU, in case of the first hospital, which is Muhimbili, you'll see that ICU was only consuming 10% compared to 21% that was being consumed by offices. Same applies to the next hospital, which is Morogoro, where the ICU was only consuming 12.9%, and the offices were consuming about 28.7%. So again, as I said, these are things that we had to bring to policymakers and say, how do we ensure that we are using the energy that is available to us optimally? So in terms of the key issues that we have been able to put in policy briefs, one, I think it's very clear that opportunities exist for energy and cost savings in hospitals, using infrastructure, using appliances that we are installing. For health facilities, we've been urging them to start very small instead of focusing on large equipment and also changes that they are doing. We've also been working with manufacturers to ensure that they apply energy efficiency parts to the products that they are supplying to hospitals, so that the health sector can know that what we are procuring is energy efficiency or not. In terms of our efforts in waste management, again, we are seeing quite a number of benefits, including reduced transmission of diseases. I think it was mentioned in the previous presentation that the hospital is, of course, an area where it's easy to transmit diseases. So by ensuring that waste is managed properly, we are contributing to that reduction, especially to healthcare workers and also the patients that are admitted in health facilities. We are also contributing to the management of air pollution. In many of these clinics and healthcare workers we're working in, healthcare settings, you are still seeing a lot of incinerators being deployed. As part and parcel of our efforts, we've been introducing these modern technologies, including autoclaves, to replace the incinerator and thereby contributing to the reduction of air pollution. We've also been, I think through waste management, been building, for example, biodigesters like the one that is being built here. We've built 2 in Tanzania through the efforts of UNDP and Healthcare Without Harm to ensure that we appropriately manage the health waste that is coming from those hospitals. But also these biodigesters are contributing to energy that is also in short supply in these hospitals. But however, I think the bigger picture is the policy shift that we are trying to champion through some of these infrastructure that we are piloting. We have recently completed the rapid healthcare waste assessment, which was done in 9 countries, and this is in response to the COVID outbreak. And therefore, I think we have results that are encouraging, telling us on where we need to work. Many of the countries that we've done the research actually do show that we can still, there's a lot of niche in terms of developing policies at different levels. It could be at national and sub-national levels. There's need for us to deploy low technology to ensure that we manage the waste that is being generated. We also need to step up the construction of infrastructure to make sure that the waste that is being generated by COVID now is properly managed. I did already mention about the biodigesters that we've built in Tanzania and a few other countries, but also I think on top of that is to ensure that we are building the capacity of healthcare workers to ensure that there is proper segregation and management of waste. In Vietnam, we have been championing and have developed a robust policy that is limiting the procurement and also helping in the management of the plastic that is being generated by the health care. In terms of Zambia, Tanzania, Ghana, and Madagascar, we have deployed autoclaves that are being used in health facilities to help in the management of waste. Let me now turn my attention to water reticulation, and essentially again, just like the other subsector, we are already seeing a lot of reduction in terms of expenditure on water that is being used. For example, in Indonesia, you could see the reduction of about quite a lot of money in terms of water that is being utilized. 75% reduction was realized over a 2-year period, which is very enormous for a hospital that is based in a country like that. We've also seen the acquisition and installation of a water treatment facility that has been supported through the work of Healthcare Without Harm in the region, and this has contributed to the reduction of use of fresh water by 70% in countries where some of these commodities are rare. In the Philippines, at St. Paul's Hospital, we have managed through the work of our partner Healthcare Without Harm to channel about 20,000 liters of water into the laundry system. This is the water that would have easily gone to the sewage, but we've managed to recycle it and using it in the laundry services of the hospital. And then in another hospital in Taiwan, we managed to recycle water that is being channeled to toilets. At hospital levels, we've also been pushing the development of policies. I think this is one of the key issues that we've been championing in the project. The idea is to increase the acceptance of some of these standards that we are introducing. Water harvesting technologies have been introduced in Zambia, for example, at Medical Stores Limited. During rain season, they switch off all their supply from the municipal council and use the rainwater to power their operations. We've also been installing quite a number of recycling investments in Philippines. At St. Johnson Hospital is one such where Healthcare Without Harm has done a very tremendous work in terms of changing the practice there. In terms of, so this is what we've been doing in terms of these things, and now we at a stage where we need to transition to the new phase of SHIP. And again, as I said, thanks to CEDA for the financial support that has enabled us to demonstrate these results over the last 4 years under which the project has been implemented. We are now shifting our focus to develop the second phase of our SHIP, which is of course being done within the context of COVID. And I think COVID is presenting a different dynamic to all of us as we implement this. And I think one key factor that needs to be mentioned is the fact that the amount of waste that has been generated as a result of COVID, either in terms of PPEs, in terms of vaccination, has doubled. So our focus as UNDP and Healthcare Without Harm is how do we go beyond the 10 countries that we have been working with. So essentially is deepening our focus in the 10 countries and bringing on board in additional countries to ensure that we support the health sector to be decarbonized, detoxified, climate resilient, pandemic prepared, inclusive, and equitable. as we move forward. So this is part and parcel of what we are putting in the pipeline for ship number 2. And also we are trying to mobilize governments, international partners, and other actors to transform the health sector production. This is where we are working hand in hand with the private sector to ensure that products that are harmful do not get produced, to ensure that we are building demand for sustainable alternatives. And finally, I think the final point under this project is also to deepen and broaden our engagement on sustainable procurement and waste management. I did already mention that. I think we are seeing a triple or more than double of the amount of waste that is being generated as a result of COVID response. Out of our work, we have also attracted the interest of the 16 member states of the Southern Africa Development Community. They have made a request to UNDP to support them in coming up with an intervention that is supposed to strengthen their environmental and social sustainability in the health sector, with the objective to ensure that the health sector supply chain contributes to human health and reduce greenhouse gases. I think the interesting part is the work that we have been able to do in this has attracted a lot of attention, and now we have a regional bloc that has made an official request to UNDP to support, come up with their own development intervention that is going to support in terms of promoting sustainability in the health sector. So within this project, we hope to work with the SADC Secretariat, Medical Stores Department, the government of Tanzania, and the SADC member states to ensure that we are promoting environmental and social sustainability dimension in the health sector, to create avenues for women to participate, to ensure that we are also sustainably manufacturing commodities within the region, thereby ensuring that we are reducing the carbon sector footprint in the health sector. So this is where I end my presentation, and again, thanking Johannes and the team for giving us the space to speak, but also thanking SIDA for the financial support that has enabled us to go this far. Thank you so much.
And thank you, Ivan, for a very interesting presentation. There is a lot of things going on. It's very interesting to see that. I just want to follow up with that. How do you see on like system solution approach of implementing a broader perspective of different solution in one hospital, and how that can be, as Daniel said before, how that can come to advantage for the community around the hospital, to use the hospital as a hub?
Well, I mean, the easiest example is the Solar for Health project, in which I think by virtually providing energy in a setting that has never seen electricity before, in itself is an encouragement for people to seek medical services. But additionally, it also provides that additional incentives for the people to work hard to ensure that some of these services can be also attained by them. I think we've seen in a few places where even local communities are now mobilizing their own resources to ensure that they also power their own houses, just because they have seen that it can work with minimal resources. Sun is available. So I think we are seeing a transformation at a community level where I think people are now seeing that this is possible. This is not theory. And also I think when we are developing hospital level policies, we try as much as possible to encourage the facilities to involve the community so that they are seen as participants, not passengers in their project. Yeah,
thank you, Ian. I see you have a question in the chat as well. It's about how to get into the hospital as test beds. Maybe you can answer it in the chat. Sure. So we'll move on in the program. Yeah, once again, thank you very much, Jan. And the next speaker is Jan Furuvald, the CEO at Kapitalguiden, the Capital Guide. And he will talk about how to find public funding alternatives for your projects.
Thank you, Johannes, and thank you to my previous speakers. I will have two parts. One will be to elaborate a little bit more around the funding for these kind of projects. And the second one, I also like to ask for projects to the Swash and Grow. So I will make a short pitch to the opportunities for companies or projects to be part of. But I will start with start with the capital guide to find the funding. And public funding is a special area, and a little background that we work with. All public funding have some political initiative or political objective and a political decision behind it. So this is the main part of the public funding. It's not there to compete with private actors, but it's a complement and to stimulate progression and development. So that's most often why the terms of loans are a little less good than from the private sector, but it's for not competing with the private part. But the important part for a company is that whatever you get public funding for, it's some kind of mean to reach a political objective, which gives the application somehow not really focused only on the company, but on the impact of the result of the company's work. You have a huge variation of different programs, and I never counted on a global basis, but somebody said it's between 10 and 12,000 ongoing public funding programs at the same time worldwide. The main kind of capital, you have grants, which most of us know. You have loans, equity, customer credits, and guarantees, and then you have blended variations in between those. To the structure of the global funding, they're all political or all public funding somehow come from states with the central bank or intrastates with the right to press money. So it's all financed from more or less the same sources. If you take United Nations, I think we all are part of financing United Nations. We are 27 countries financing the European Union. The Nordic collaboration is financed by 5 states, and it all comes down to the same source, more or less. So to keep a global view on this, that means that you can most often find both global and regional and sub-regional levels of public funding. And I try to illustrate this to a certain extent. So since we are from Sweden today, we take Sweden as an example. And the most common way to search for public funding is to go to the programs in your own country. Otherwise, you can go to the Nordic one. There's similar opportunities between the 5 Nordic states. And if you go on the European Union level, you will have 27 different countries that actually will have the same, more or less the same rights to the same programs. Globally is for everyone. If you go on the African Union or for the sub-Sahara states, you have 54 or 53, that someone corrected me yesterday. I'm not quite sure which state that disappeared overnight. But in this case, you have a lot of countries. The differences is mainly that the OECD countries, they have programs to expand, to share knowledge, to get export, etc. And for the development countries, most often for receiving or for establishment or to receive the competence transfer, knowledge transfer, and so on. But in this case, it's a view on the global, which is quite important when we're working on this. In this case, I think I will thank Daniel for a nice layup of differentiation on how to find financing in different parts. This is an example, a little extended example of a clean tech company from Sweden that should establish in a region, a community in East Africa, in Tanzania. And just to show the different variation, you have both public funding for the customer, for the receiver as well as for the company. And you will recognize, if you are from Sweden at least, the left side. And if we say SIDA, they don't do direct investments to large extent nowadays. I saw we have a SIDA representative, so you may correct me if I'm wrong. But they go through intermediaries, and the intermediaries themselves in this case have programs that actually can go both to the public-owned community or to a company where the company is a project partner. You have a local one in Almi, which both give national loans and export loans. European Investment Bank most often go through others. Swedfund do both equity investments, but they also do accelerator programs and pre-study financing. And in those cases, this money most oftenly will go to the community. That means the buying part, that means the feasibility study done. And then you also have NOPEF, which is a Nordic institution that actually provide with money within environmental and so on. On the top of this, on the top right, you have an example of Nordic Development Fund. They both finance the African Development Bank and other World Bank institutions. Upright on the second part, you have NIB, Nordic Investment Bank. And as an example, they go through African Export and Import Bank. And they just, I think it's half a year ago, they provided them with a 100 million credit line to actually support the loans and guarantees, both to private companies and as well to public institutions. And then you have several, and IKN and SEK is well known, Exportkreditnämnden and Svensk Exportkredit. So what Daniel talked about on the interdisciplinary business areas make, of course, a hospital extremely complex as a project, but it extends the opportunities because you have so many legal entities as part of a project that each and every one of the company, whether they are Swedish, European or local, somehow can apply for these kind of public funding, both in grants, loans, equity, and in guarantees. So the complexity extended the opportunities of public funding. So not only go with a major project because that will make a limitation, but each part can also do separate applications depending on what they like to provide, which gives and makes some kind of contribution to a political objective. So the last one is most important. So this is only a way of working. When you have the project and the business opportunity, you go into financing, you need the private funding, you need the public funding, if you like to go this way. And then you have some kind of financial optimization, because then you will have several alternatives. And in that case, you do the project plan, you do the mapping of financing, and so you do the optimizing. How could this make the best support for me financially? And to take the entire project at the same time will give less opportunities. So when you start, you do a small part, small application, then you build further. And a good advice, you should only apply for public funding when you already have money to co-financing this. So if you are in lack of money, public funding is not really the solution. So you should ask for money for public support when you actually have the money. So, questions on this one?
Jan, I think we can go in on the swash and grow part. So if you would like to mention some words about that.
Absolutely. So you can see the alternative presentation. Within Swash and Grow, we have in one of the sub-projects, we have a group called UTS, which are several companies working in within the area of supporting energy, water sanitation infrastructure to build and deliver a system for a sustainable future. And then we have grouped several companies with several competences, and I will come back to that a little later. The Urban Tech Sweden is a non-profit organization. It's member-based, and it was established 2 or 3 years ago from a Swedish organization called Teknikföretagen, which was took the initiative. Today, I believe it's free from any connections except for membership of their members in that case. And the Urban Tech Sweden group within the Swash and Grow, we try to combine both the financial part, the technology, the know-how, and both from the private and public sector. And this will actually, for us, give the opportunity to support both the innovations in Sweden within the overall part of Swash and Grow, as well as the export part of this and how to reach development markets and humanitarian aid areas with new innovations. And of course, increase in urbanization and treat to climate change will actually drive this faster and faster. That's our view on this one. So the platform contains technology, which both is technology provided by project leadership, by long-lasting time of running projects in this area. We also have financing, both the knowledge on the private side and on the public side. We provide this also with knowledge, and this is experience, of course, from several years of working in the international environment, and how to transform this project reaching the sustainable development goals, which is some kind of framework we work within. And I think you heard both Sten and Daniel referred to the SDG 2030. In order to make this happen, we believe that this group and these knowledges actually can speed up the implementation in development areas, not necessarily the procurement itself, but the delivery part, and also access to different system integrators, which actually will make this a smoother project. So this is the platform we actually work within, and what we are looking for now, and I hope to recruit one or several from this forum to ask for contact, and we will see if this platform will be able to support you in your project. So please feel free to make a chat. You can contact with Johannes. I believe his email address will be available, and I will also provide you with my email address in the chat, so you can both bring questions, and if you're interested to be part of this, you are most welcome.
Yeah, thank you.
Here's an overview of the partners.
Yeah. Thank you, Jan. Yeah, financing is a very central part in this to work in this kind of way. So we will gladly hear more about that in the panel discussion on how that can be working. Yeah, so there are some comments in the chat. You can look at, Jan, maybe answer to that, and you're welcome to contact me or Jan if you have any projects that where you're looking for technology.
The first one is it wasn't compliments, so I say thank you.
Yeah. So yeah, we have to go follow the program here. So we'll go to the next speaker. It's Dr. Shantanu Sharma. Deputy Director at Mamta Health Institute for Mother and Child in India. He will talk about gaps and scope of improving infrastructure in facilities for sustainable healthcare in India.